The South African Medical Association raising concern earlier about the about turn of the Department of Health. First, government issued a circular that would have stopped contact tracing in most cases. It also said that people who had been in contact with a COVID-19 patient would no longer have to quarantine. Then on Tuesday, it withdrew that circular, meaning that the old protocols around quarantining and around contact tracing are back in place. The Health Department has apologized, saying a revised circular will be put forward soon. To discuss, we're joined by the Vice-Chairperson of the South African Medical Association, that's Dr. Mvuyisi Mzukwa. Doctor, thank you for being with us. Firstly, have you engaged with the Department of Health? Any movement?
Good evening to you and good evening to your viewers. Thanks for having me in your program. So far, there has not been any interaction with the Department of Health from the SAMA side, but we have raised our concerns, with everybody because we find this very strange and disappointing as we know it.
When it happened, you even said you were worried that the revision was because of political pressure. Is that still a concern?
Yes, the main concern is that even though the department purports to be transparent, but we don't see any transparency from what they have given us so far. Remember, they got this advisory from the Ministerial Advisory Committee on the 23rd, on the 16th of December, and 7 days later, on the 23rd, they decided to make it public. And after that, a few days later, not even a week, they then decide to withdraw. That was a very tardy, very clumsy, and very disappointing, because we know that there's only one advisory committee. The Department of Health has not told the public who are these scientists that have given them advice other than the MEC. So they need to come out clean and tell the nation how do they arrive to that decision. Because we all know that quarantine is not serving any purpose. It's useless, a measure when you deal with COVID-19. Because you remember at times you get cases up to 30,000. How do you do contact tracing for 30,000 people? So it's a measure that does not make sense. That is why we even said when the MEC gave that advisory that it was long overdue. This is the stance we are saying today, to say that it is a useless measure to use to combat COVID-19.
I had COVID recently, and somebody did call, and basically all they asked was, do you share your house with anybody else? Give us their name. They didn't go into the details of all the people I'd been in contact with, and it would have been extensive. It seems like Omicron is spreading so far and wide that we're all in contact with it at some point. So that's why you're saying it's basically a waste of money, somebody picking up the phone and even checking who you've been in contact with. Like
you said, correctly so. You know that even when this contact tracing was being done, it was very disappointing. We had reports of families who, when one of the family members contracted COVID-19, these contact tracers came 2 weeks later. It was just a joke. And we don't think that we should be sustaining that. It's a waste of taxpayers' money. We should do away with that thing called contact tracing, because it does not serve the purpose, especially when, like you said, you alluded to earlier, that we are dealing with a highly contagious virus, a variant at the moment called Omicron. I mean, how do you deal with contact tracing if you get almost every day up above 20,000? Who is going to do that contact tracing? Yeah. Unless there is somebody who is benefiting in a form of a tender that is being kept to continue abusing the monies of the state.
Well, surely that should be public. Have you tried to get hold of those details, or do you believe that's not your place? You're just raising the concern?
We're raising that concern, especially we know that, it's public knowledge that this decision didn't make any sense. I mean, just look at recently, they went out in public and removed the curfew. That curfew was not removed because we had to. It was because they have no capacity to implement that curfew thing. And they met and made a decision that it must be done away with. So we know that, and they quoted economy. It's because they want the recovery of the economy and stuff like that. But what about quarantine? Why would you keep a person who is self-employed away from work and who is not having any symptoms, who's not having any positive test? Just because he came into contact with a person with COVID-19. There's just no consistency with the thought process of government at this point in time. That is why we're saying there must be a lack of leadership at that level. That is why we are complaining about it.
Well, Doctor, while I have you, and final question, because there are differing views on the curfew. We've just heard that COSATU is unhappy it's been lifted. What does the science say? Is a curfew also superfluous? Are you happy that it's been lifted?
Well, it has not been implemented. Whether it was there or not, people have been moving up and down the whole night. And the only challenge is that if you implement that, it also puts pressure on the local on the healthcare institutions. But we know that government does not have capacity to implement the curfew. So that is why they just washed their hands and said, no, we're doing away with curfew. Not because they wanted to do away with curfew. It's because they wanted to do away with responsibility, because you can't use police to deal with these curfew things when you're dealing with large numbers of people. It was not implementable at all.
All right, thank you very much. Concerned about government's leadership.